Somebody's got to remind me and Sandy to do that, okay? For those that are just joining us, I am going over the course schedule. I have got all the way down to the student presentations and the evidence-based practice paper. Please, if you miss class, get with a partner in class and make sure that you understand the due dates. The evidence-based practice, I'm repeating this, the evidence-based practice paper and the presentation go together. The presentation will be a class presentation. Everybody's is due the same date on the 20th. You can do a PowerPoint that kind of outlines your paper. And I said that you can have maybe a little question answer session from the class at the end of your presentation. So they could ask, you can ask for, is there any questions? That might help you get that 10 minutes in. And as far as the rest of the papers, it's pretty self-explanatory. We have the midterm exam and the final. You will get the questions ahead of time. You may get 20 questions to study, and we may choose 10 or 8 or 15, I don't know yet, to go on the final, because the final and midterm, because they are both writing intensive tests, exams. We're going to do our exams through a company called Honor Lock. So you will need a webcam. Like Sandy said, you probably will need to show your identification if they are monitoring you guys. We don't know either. We've never used this company, so we don't know exactly how that's going to go, but we will find out next week. One of the instructors in Jeff City is giving an exam already next Tuesday. And after they give that exam, they will be able to give us more in-depth information as far as how that system works, okay? Yes, you get the questions in the week before the exams. Any other questions? I think FA came in a little late. But if you have questions, let us know.
Barb, what about the pass point stuff?
The pass point exam is kind of like the diagnostic exam. It's another indicator of where you fall if you would go take the NCLEX today. So we are going to be looking at it from the diagnostic test, from your Kaplan integrated exams that you're doing, your course exams, of course, and the pass point is just, it's a freebie that you get with the passport. It's not freebie, you paid for it. So,
but it's still a book though, right?
Do what?
I mean, it's the one that we have with the book that oh Christ. We were using it for for babies and for respiratory and cardiac. I mean, I've looked at it and there's nothing on there as far as a test to take. So I'm just kind of like.
Sandy's going to get you that information that night.
Okay.
It's kind of like when you, what was the other exam? It's kind of like us opening the diagnostic exam for you. We have to open it or something for you to get into it.
Oh, okay.
So it stays secure that way.
And when do we take that?
That is the 26th.
Of April?
Yes,
March.
that would be March. That would be next Thursday night.
Mm-hmm.
So be sure and be here. Any other questions about that? I don't see any raised hands or anything. I can't see everybody though this way. How can we study or prepare for multiple choice questions? One of the ways that you can study for that is to go into the Kaplan resources that they have for you guys, where you go into the, what do they call it? I'll have to bring up Kaplan here after a while anyway, but where you access your resources, like if you want to watch the videos and such, and it has your channel in there, you go to that, and there are some really good seminars that have been recorded that you could look at. It's got test taking strategies, it's got prep for the NCLEX exam. There's 3 or 4 of them for that. Multiple choice questions in this class are going to be focused on what we are learning. So most of them, I say most of them, a lot of them will be geared toward leadership and management, of course. That's a broad topic. So if you want to narrow that down, it will be delegation and prioritization questions, especially. So if you have a book also, like Saunders or Lippincott or Susie Q or whoever, some of the apps that you have on your phones, focus on delegation questions and prioritization questions. Okay? Does that kind of answer your question? All right. Okay, great. And then we're going down. You're going to have another Kaplan exam, critical thinking one. We use this to measure if you have improved in your critical thinking skills from the time that you took the critical thinking exam in fundamentals. So we kind of use that as a group, not you necessarily, but as a group cohort score to look at for accreditation, for the NLN accreditation, and for Missouri State Board accreditation too. Then we've got your final exam, kind of talked about that. Kaplan weekend, we may do that online. We're not sure about that yet. The dates that we had set to have it at Phelps were the 1st, 2nd, and 3rd. So we're kind of waiting to see how the virus thing goes, and if they can get us an instructor down for those dates. We'll let you guys know as soon as we find out, though. And then it's like graduation time after that. So any other questions about the course schedule or about Kaplan, etc.?
Hey, Bud, can you hear me okay?
Yes.
Okay, sorry, I had to rig my mic in a really weird way. So you referred to next week as if we were going to be physically present. Do you guys expect us to have class in seat this week or, some other time in the following semester?
Seated classes?
Yes.
No.
Okay. All right, I wasn't sure if you guys had officially taken that off the table or if you were kind of holding out that maybe we would be seated at some point.
No, I don't expect to see you guys until pinning.
Okay, kind of what I was Thank you.
Yeah, I know some of you have some restrictions where you work and where you live. And as long as this virus thing is going on, which it is expected, at least for the next 6 or 8 weeks to go on, we are going to keep this course online, finish it out online, unless there's some problem or issue, which I do not foresee. Do we have an alternative for pinning? No, that's too far out for us to really give you a definite answer on that one. When are the online things going to be posted for us, those of us that can't do clinicals at the hospital? We're going to start on some of those tonight. Will our family be able to come to pinning? I don't know.
Good, I didn't want to come.
Do what?
I said good, I didn't want mine to come.
Oh, Nikki. Oh, goodness. I guess we could do a virtual pinning. How would that be? Oh, Hampton Inn. Why don't you check on that, Alyssa, and see if that might be an option for us if we can't get on base. We need some. We can't. Unfortunately, I don't think they would let us pay for a space outside of the fort. So we have to be cheap. We have to do free.
Explain to me how we are virtually going to have a pin put on us and virtually light a candle.
I don't know. I'm just kind of thinking about that. It would be kind of neat to do though if each person would turn on their camera, you know, have on their scrubs, have their lamp, walk into their living room or wherever, walk outside on the porch. It's going to be a pretty day, I hope. That'd blow out the candle. I'm just thinking out loud. But walk into
Virtually,
another area in the house and have one of your family members pin you, and everybody watch. Wouldn't that be cool?
no, because if we do it virtually, I'm not wearing pants, Barb. Like I'm not. It's not going to be a full body thing. I have like.
It's not no pants pinning. No. Oh, yeah. Somebody said they'd rather have it off post. We don't want you guys to pay for anything. They do ship the lamps and pins to the school. We'll have to work that out also. I better write Megan a note on that one. That's a good point. And find another scratch pad here. How are we going to get our mail? I hadn't thought about that. Good point. They may leave it at the post office. We have what they do now with the mail. Of course, it'd probably come UPS or something, but what they do now with most of our mail is we had to go pick it up at the post office anyway, so right behind the building there. Oh, you received your lamp to your house. Oh, okay. I didn't know that. Did it have Christine, did it have the emblem on it like it's supposed to? No? Oh, that goes back. That goes back. That's not good. We were assured they would have the emblem on it. That's not good. I'll fix that. We'll find out how you can get that back to them. We've got plenty of time for them to get us another one. Hoping not to have to buy a new top. That's funny. Anybody else get their lamp at home? Not yet? Okay. If you get it and it's plain, don't tear up the packaging. If it's a plain lamp, put it back in the package and we'll get them to reimburse us for postage back. I don't understand why that happened. One thing after another, huh? But what we do is we roll on. We deal with things as they happen. Okay, any other issues, questions, anything anybody got? Okay, I'm going to see if I can get into Kaplan here. Okay. Tell me if you can see my Kaplan screen. Yes now? Good. I'm so happy this is working tonight because earlier today I was trying to work and I couldn't get emails to go out. I couldn't get anything to download. I didn't know what was going on. I was getting really frustrated with the internet. And it's raining here now, but it wasn't earlier today. And now it's raining and everything, knock on wood, is fine with my internet. So I don't know what's going on. Okay, wanted to go back to your NCLEX resources and show you where I want you guys to get started on some Sims. Since this is free, it's included in your package. If somebody could sign on to their Kaplan and make sure that you have access to the resource that I'm going to show, if you could follow along with me, please, that would be great. And what you need to go to is this page here. Is somebody on it? If not, I'll give you a minute because I want to kind of go through it and, like I said, make sure you've got access to it. Okay, Christy, thank you. You guys just will not come out and talk, will you? Except Nikki and Bobby and Gage.
Shocker.
A crazy household. Kids screaming in the background, yeah. Oh, B. I don't like to hear my voice either, but it sounds funny when you record your voice and listen to it. It doesn't, you don't think you sound like that. Dogs barking, kids fighting. Okay. Is anybody on it? Darla, yes. Christy, yes. Elaine. Okay, great. If you go down here to clinical resources, do you have that down at the bottom? Where it talks about mid-fidelity sims. That's where you need to go. And first thing you need to do is watch the mid-fidelity orientation videos. Now, to me, I don't know. This lady kind of puts me to sleep. But you do need to listen to them. Pay attention to what they say. We're not sure yet because we haven't been all the way through all of these yet. But I'm going to put Jana, I think, in charge of that to assign how many hours it takes to do these. There are, I think, 5 Sims on here, and they have 6 different clients. How that works, I'm not sure either. I did look at them briefly today. I went through the orientation video. You get a score based on the first time that you go through the simulation. And it's very important that you don't click, you can click exit, but you can't click finish. If you click finish, it gives you a score. You can also go back and do them again, but it won't show a score on your main sheet anymore, if that makes sense. You can do them as many times as you want, but I'm sure you only want to do them once, probably. But they are mid-fidelity simulations. So after you watch the orientation videos, then you go to each one of these 6 topics and go through those simulations. They suggest that you do them in order because I think the different clients keep coming up in different scenarios. Like here with geriatrics, grandma may be in that one and she may be in psych also. I don't know for sure because, like I said, I haven't been through all of them. And we're going to put Jana in charge and Andrea and, oh shoot, I forgot her name. Just slipped my mind. Your 3 clinical instructors that don't have people in the hospital. Okay? This essential nursing skills, if you want to brush up on some videos for how to wash your hands, sterile gloving, all of these things, this to me is more for the fundamentals class. Therapeutic back rub sounds good, but You guys can probably do that on your own time. A little joke there. Can I see some ha-has? Yeah, I want one of those. Crystal, yes, I'm sorry. I can never remember her name.
Barb, when are we supposed to do these fidelity situations?
Start them now. This is going to be clinical time. So as soon as we get narrowed down what times we're going to assign to them, I think typically if it takes you an hour to do them, which I'm going to have Jana go through and do them, see how she does. If it takes you an hour to do a simulation, it typically counts 2 to 1, so it would count for 2 hours of clinical. And the reason for that is because when you're in clinical, you know that you have a lot of stand around time. You don't necessarily, you're not interacting with the patient the whole time that you're there, that whole 10 or 12 hours that you're there. You're doing other things, you know, you may be watching a procedure or something else, but simulation is focused time. So it goes, you get 2 clinical hours for every hour you're in a simulation. And they haven't really given us any guidance on how many hours this takes either, so I'm not sure on that. Clinical paperwork, after you do a SIMS, you're going to have a debriefing with your clinical instructor about that simulation, how you did. They're going to look at how you did, what you scored low on if it shows that. They may go through some pointers with you. Many of the simulations that we've looked at, and this is really good because this will help you with NCLEX. Many of them have things like you're going to start a Foley catheter. You're going to put a Foley catheter in. Here's the steps. Put the steps in order. Or and it may be something simple as you enter the room, you wash your hands, you introduce yourself to the patient. Same thing that we did when we did SIMS in the lab or check off skills in the lab. So it depends on how you do on your simulation as to your debriefing with your clinical instructor. So the clinical paperwork, not real sure on that, other than maybe just your anecdotal, just a little anecdotal note saying how you felt about that simulation. Did you learn anything? You know, we haven't quite gotten that far yet because we've been trying to get clinical sites, and then we don't have sites, that we do, and then we don't. It's not going to be a lot because most of your work is going to be within that simulation. We have set up with Shadow Health some free simulations. Those are going to be worth, as soon as we get the instructor sign on for that, Jeff's working on that, those are going to be worth 10 to 12 hours. They cover, they have one on leadership, and the other one, the one that takes a while, is going to be your health assessment because it is advanced health assessment. We're giving you 8 hours for that one. Oh, yeah, the governor said no if it's over 10 people. That may change by May, though. Just tell them if they could keep that kind of, Alyssa, if they could kind of keep that in mind, that we may have a need if the fort doesn't open up. But if the restrictions do lighten up, I guess you all probably seen, getting off subject of SIMS just a little bit. We have a case in Pulaski County Health Department just announced that positive COVID-19. Did you guys see that? Well, Bobby said we could do smallish groups. Alyssa, we can do it at your grandparents' lawn. Yeah, that'd be kind of cool. You guys saw where we had a case local, and what I'd read about that local case was it was not somebody that had traveled, so that's kind of spooky. You know, they may have picked it up at Walmart. I don't know. I always say Walmart. I don't know why. Okay, so we've got probably 10 to 12 hours in what Shadow Health. We have used that product before. Jeff and I used it a couple of years ago. It's pretty, the advanced health assessment is pretty intense. So that would be something you might want to study up on because it's like a head to toe assessment, advanced assessment, which you guys should be able to do. Yeah, there's more to come on those infections, I'm sure. Just now hitting the local area, and you know, no telling where it's coming from. And you have a case on post. I'd heard that too. So yeah, you guys just be safe, stay careful, and you know, stay home. I had to go to the store today. This is getting off topic too. Dad always wants sugar in his cream of wheat, and we'd run out of sugar. It's bought like 5 pounds a couple weeks ago. Don't know where it went. So I ran down to the store thinking, man, I'll get some sugar. No sugar. Ran to the other store, Town and Country, no sugar. So I came home and told him, hey, you're going to have to use brown sugar. I've got brown sugar. So my husband goes to the store, and he goes in Town and Country, and he comes home with three of those little boxes of cane sugar, which is fine. I didn't even look for that. But I know the shelves are getting empty, which is crazy. Donnie, you can't study at home. Yeah, I know. That's hard. Fortunately, though, there's not a lot of studying in this class. There's a lot of paper writing. But you do need some peace and quiet for that, too. You may have to change the kids' nap times around or bedtimes around or something so you can get a couple hours in, you know, studying. Anyway, I want you guys to all of you, not just the ones that aren't having clinicals right now. I want all of you to start on the Kaplan simulations. The reason for that is, I think there's 4 of you on post. We could get kicked off post any day, and you may not have your hours in. You're not going to have your complete hours in anyway, probably. So, oh, it's your husband? Oh, well, I don't know what to tell you there. Yeah, okay, Natalie, you too, huh? Yep. I just tell mine to go away. Leave me alone. I'm gripey. Leave me alone. Okay. Any question? Do we have to complete the total 80 hours then? The simulations, like I said, are the 2 to 1. So as soon as we get a week or 2 into this, we will see if we can come up with 80 hours. So you may be doing, 40 hours of sims equals 80 hours of clinical. We may cut the hours back on clinical and just kind of see how we go on that. I do not know. We don't have a definite plan approved yet because it had to go to Jeff City this week. We got notice at 6:30 last night. They needed it at 8 o'clock this morning, which wasn't going to happen, but that's what we were told. Anyway, we got it to them this morning. So we have to get that plan approved before we can carry on with what we're doing. But at least we've started class, we're starting some sims. We know we're going to have to do that for clinical. And as far as how many hours we get in, I don't know yet. I'm looking at the chat. Yeah, I know it sucks because of the not getting the preceptors. Can I elaborate on the proposed plan? I think I've told you everything I know right now. We've got class in place on Zoom, taking attendance. We've got Sims lined up. We're going to start with the Kaplans, move to Shadow Health as soon as that comes through, see where we are on hours. By at least next week, we should know the clinical hours. And the clinical instructors coaching and mentoring you guys with your Kaplan and your integrated testing and Kaplan, testing strategies, your papers. They can, they're not going to tell you how to do your papers, but they can help you with ideas. They can help you with research. They can help you with your APA, anything like that. I think that pretty well covers the plan as far as what concerns you guys. We have to do a lot of reporting after class. We have to do a lot of letting main campus know how this is going. So if you guys have any suggestions or complaints or comments or kudos, let me know, because we have to put that into our report, I guess it is. And they've got several other contingencies that we have to deal with. It doesn't involve you guys, because we're also talking about first year here too. First year 104 can't do clinicals, so they're having to go to the simulations, and they're having to go to online classes just like you guys are. Any question in specifically, Alyssa, that I didn't answer?
No.
Okay. Anybody have any other questions before we go on break? We're going to come back. Can we do a comprehensive head-to-toe assessment on someone on our household? A four-legged one? No. We got to do the sim so that everybody does the same thing. Yeah, I don't know I'd want to see a four-legged health assessment. Raw steel tape or first, yes, and then they're going to relook at it again. Benita, tried looking at the recorded session from last night. Did you just try the one that I posted on a page? Yes. Okay. I'll have to work on that some more. Thank you for letting me know, though. Now, some other people got on it with a link that I sent. What if we can't go at all to what? Neji, what? You was able to see it with the link you sent. Yeah, Elaine was able to see it with the link I sent to her email. I shared that off my other drive. I get in trouble for that. If you can't go at all to clinical, your simulation hours are going to count for clinical. Okay? That's why I want you guys to get started on the sims this weekend or tomorrow, whenever you can. Okay, we're going to go on about a 15-minute break. Everybody can go to the bathroom, get a drink, settle your kids down, whatever you need to do. Yes, the sim hours would still count if clinical sites opened and you voluntarily wanted to do some more hours, we would let you. I don't have any hope really that they will open back up by the time 1st of May comes. What about those people who have access to clinicals? You just keep going to clinicals, but still do the sims. These sims, anyway, that's on Kaplan. They're not going to count for a whole lot of time. And that would be working toward your 80. Because they could shut us down tomorrow at 4, you know, or Monday they could shut us down, and we'd be in trouble if, you know, we wait and don't have hours in. So that we decrease the time we're physically there due to the sims. Your time in clinical would count. So if you got 40 hours in there, you'd have to do 20 hours of sims. We're kind of playing it week by week because we just don't know, but we want to be ahead of the game on that one, if that makes sense. And if you look at it, your evidence-based practice paper is going to take a lot of time, and we don't want you having to do work, kids, evidence-based practice paper, and clinical hours in the last 2 weeks of this course. Does that make sense? Now would be the time to get in and get it done and get it over with. All right. 15 minutes. We'll start back about 6:15, and we're going to look at some evidence-based practice stuff, okay? To help you with your papers. Okay, I'm going to stop the recording, and somebody please remind me to start it again. Okay. And Elaine and Donnie just posted in the chat how to get to the remediation for your diagnostic exam, so everybody can look at that. Go back and do that if you didn't do it during spring break, which many of you forgot and did not, but that's okay, I forgive you. It's been a rough couple of weeks. We've had other things going on with spring break and everything, so. Let's see, I think that's it on Kaplan. Anybody have any questions about Kaplan? You can pretty well navigate it, get around in it. You played with it, can see stuff.
You said you wanted us to do the mid-fidelity simulations, right?
Yep. Yes, ma'am.
And just any of them, or all of them?
When you click, after you go to the orientation video, it suggests that you start with the beginning one. So that's what I suggest, is start at the top and go down. I don't think they're very long, but we'll, like I said, we'll see. But any time that you spend on them, you're going to get about double your credit for clinical hours. But we'll let Jana make that decision on how long that is going to be. The orientation video is right there under clinical resources. There's a, see that little link right there? Right above, yeah, right above the mid-fidelity simulation drop-down box. Okay? Anything?
Hey, Barb.
Yeah.
Is there somewhere that we need to post what our EVP or EBP paper topic is, so we're not choosing the same topic as someone else?
You can choose the same topic as somebody else. That's fine. Because what I find when you do that is sometimes your results come out different. Like if you are comparing and contrasting something, let's see.
I mean, basically, I want throw my hat in the ring for prone and ARDS patients because, yeah.
Okay, that's fine. Let's see. I think Lindsay is also doing that. And that's fine because you may find different research and different information on the topic. You're going to look at different
Now,
articles.
outline done on something else, so dang it, Lindsay.
You can do the same thing. I said, I don't want all 30 of you, 29 of you doing the same thing, but gosh. But I've had people do the same topic and just come at it from a different direction. And that's good because when you're doing your presentation, we learn different things from you guys. And that's where we learn is going to be from each other. You know, you're going to find some stuff that I don't know because I haven't researched it. Let me look in the chat here. I don't want to miss something. Is chocolate beneficial to certain diseases? Yeah, dark chocolate. That's funny. Yeah, you need, well, what, Sherry, on getting permission for your topic, what you need to do is you have to have your outline in by Sunday. That is your approval to go ahead with your topic. Okay? And let's see. Like I'm going to pick on Bobby. Bobby, are you there?
Yes, ma'am.
Can I pick on you?
By all means.
Bobby was going to do wound care, something to do with wound care and maggot therapy. And how what did we talk about?
A comparison between the two.
Yes. As far as like
I've-
he was gonna do maggot therapy, but maybe is the outcome different, better, worse than some of the other maybe traditional therapies?
Yeah,
What's,
I've actually found a couple things that have a comparison between the two. So
yeah.
it's you know, it's pretty neat.
So that's where I want you guys to come from on, like, you pick a nursing topic. Let's see. Faith, are you there? Or can you talk? Toilet paper and preventing COVID, yeah.
Yeah, I'm here. I couldn't figure out how to turn off the mute.
That's okay. Let's help Faith with her topic. She is exploring staffing issues. Faith, can you elaborate on that a little bit?
I was just gonna look at how nurse to patient ratios, how it affects health outcomes, patient satisfaction, like readmission rates, that sort of thing.
Okay. And something that you could look at there would be like California has strict staffing ratios. So is the healthcare outcomes better in California than they are in Missouri?
Right.
You know, things like that. I don't think we're going to go with the toilet paper one, you guys. I don't know what we do with that. I still don't understand that one. Toilet paper.
Barb, you can go so many different ways with that. So many different ways.
With toilet paper? Yeah, it's got a lot of uses. I know. I know that.
With us, we're gonna have to deal with paper towels because we can't find toilet paper anywhere.
Exactly. Gonna have to go back to the old days when they used corn cobs.
Hey, Nikki, I have plenty of toilet paper. You just let me know, boo.
Hey, thanks. I'm
welcome.
serious. It's a bad deal here in the Ozarks.
Yep. Yep. Well, what did we do before we had toilet paper? leaves. I don't know.
Barb, you're living a rough life, dude. Like a rough life. Corn cobs and leaves. I don't even want to go.
I'm not quite that old, but I've heard stories. Oh, let's see, what was I thinking? No telling what I was thinking. Donnie, you want to talk about your topic a little bit? Can you come on line? Seashells. Oh no.
Can you hear me?
Yes.
I am doing about families being in the room for whenever the patient codes and how that affects the family and the nurses and all that.
Okay.
Because I'm outside, Sherry. I can't sit down in the house. I'm going crazy. I got my iPad, so we're all good.
I understand.
I'm going to get corona.
It's floating around in the air out there. Danger, danger. Okay, somebody else want to talk about what they're thinking about doing or to get some ideas from the group?
I did mine on diet. You haven't approved it yet, but I guess this is a good time to find out.
Okay, let's hear
My
it.
thesis was if the United States supported a high protein, low carb diet instead of the standard American diet for individuals with no other comorbidities, the healthcare systems would save approximately 40% of their annual expenditure. Because I looked up how much healthcare services spend on cardiovascular disease and diabetes, and it's about 40%.
Okay. So how could she develop that just a little bit further, you guys, if we were going to do a compare and contrast?
Well, I was going to do an expository essay. So I'm trying to convince you that I'm right.
Oh, okay. Okay. And I kind of know you're right, but what I was leading to or thinking about was the longevity of people that live in some other countries that have universal health care because they get all their health care free. Preventative disease. Yeah, I'm throwing out some ideas for others too, not you necessarily.
Barb,
Yeah.
I'm going to do mine on why is the UTI our go-to test, or testing for UTI is our go-to test for geriatric patients with cognitive disorders or cognitive changes.
Okay. That is kind of a fact because it relates to acute confusion in the elderly.
Yeah, I know, but there's other tests that we could run also that,
Okay.
you know what I mean? Like if we did that above like a blood test to see if their sodium was out of whack or their potassium or something to that sense.
Okay. So your thesis would be something like, why do we go to the conclusion or assumption that it's a urinary tract infection versus electrolyte imbalance? Why do we always check for that first?
Yes.
Okay. Good. Debbie says wanted to do something about nurse shortage and burnout. So how could we help Debbie with her paper? What would be a good question that we think of nowadays with burnout? Just throw some ideas out there on the table.
Does nursing shortage lead to burnout in situations like the one that's going on right now?
Okay. This is a very high stress situation right now. There's probably some good articles coming out on that because the nurse has to take care of their family too. And it's kind of scary. Things like that are scary.
How about burnout as far as pay is concerned. You know, I think a lot of nurses stay in a type of nursing or a position in nursing for money, you know, and not because it's their passion or because it's something they want to do.
Okay.
Do career-long night shift workers have higher rates of burnout than day shift?
Okay. Night shift workers and burnout, a higher rate than day shift, you think? What do you guys think about nurses that go straight from school into a specialty area, a high stress specialty area? Like some of you guys are going into OB, ICU, ER, straight out of school. What about that? Do you think that might lead to reality shock or burnout?
No, I think it's a good thing.
You think it's a good thing?
Yeah, I feel like if you go into that specialty, some people find themselves in there for like 20 years. You get a lot of experience.
Mm-hmm. And it probably depends though on your orientation. A lot on your orientation. If you get a good orientation or not, because you can get in there and say, "Oh my God, what have I gotten into?" You know, but you could do that on a medical floor too, or a nursing home if you went to work at a nursing home. And you're the RN, and all of a sudden you're responsible for all that wing and that LPN working with you, and the 2 or 3 nurses aides that's working with you for the 60 people. Let me see here. I got some ideas in the chat. Yeah, your PICO question is your thesis, because you're asking a question, and it doesn't have to be perfect. Hand hygiene teaching strategies among nursing staff. Okay.
I don't know I'm on there. Barb, I was thinking about what's better for chemo patients, social distances versus like mask and things like that as far as their psyche and overall health. Is that a good topic to go into?
If you can find some research on it, maybe.
Okay. Because
Yeah.
I know they've changed that with my father-in-law versus when my husband was doing it.
Mm-hmm.
Okay. I'll see what I can find.
Yeah, just dig in and see what you can find in the research. Burnout of nurses in burn units. Yeah, that's a very high stress area, specialty area, because of the pain that the patients are in constantly. So yeah, okay. Think you need experience elsewhere. Yeah, some nurses go on, and some nurses go to a med surg unit for a year, and then they're eligible to do travel nursing where the big bucks is, and they are, you know, they don't have a lot of ties at home where they have to stay where they're at. Travel nurses, I think, sometimes get the worst patients, the most critical patients on the floor, or the most needy, or the most confused, or, you know, what we might call potential problem patients, or not really problem patients, but patients that could be in danger in some way. And you have to give them a lot more attention. And it's kind of like the same thing I was talking about. Sometimes when you get pulled from one area where you're used to working and you get pulled into another area, you get the worst, most critical patients, just because. And I've seen nurses, and this is that lateral violence thing going on, or horizontal violence thing going on, kind of under the table going on. The charge nurse will assign that travel nurse to those patients because they're thinking in their head, she gets paid twice as much as I do, or he gets paid twice as much as I do, so he can handle a bigger load, you know. I don't know. I know that goes on. Start as a nursing assistant, worked your way up. It depends on who's going to train you, how much experience you're going to get before you actually get let go on your own. That is so true. So true. Yeah. And it also depends on the different experiences that you seek out for yourself during that time and your continuing education. And there's another topic someone might be interested in. Why do some states require continuing education and others don't to maintain your registered nurse license? Oh, you got no training. That's not good. That happens. Definitely happens. It's not good, but it happens. Nurse violence and being able to fight back. What do you mean by that? Being able to fight back.
Sorry, can I find my button?
What do you, sorry.
I know I read an article recently about before when nurses would have violent patients that became violent, the nurses basically subject to the abuse and didn't have much power, versus now they have more research on their side to stand their ground, fight back, things to that extent with the patients and also with law enforcement.
Okay.
I'm wondering that too. Like, what if, like, honestly, what if a patient like punches you? Like, what do you do? Like, can you punch them back? Do you lose your
Oh,
license?
no. No. They can punch
You
you,
say
they could stab you, they could choke you. You can fight back to protect yourself, but just enough to get away from them. Yeah.
So at Phelps Health, I'm on the violence committee,
Uh-huh.
and by our policy, what we suggest is what we call, and this is mostly for legal reasons, evasive maneuvers in order to leave. So if you fear for your life, obviously do whatever it takes because it's not worth your job, even if you did get fired. But if the person just assaults you, pretty much do your best to get away, or if you're with a group of people, restrain the situation.
Right.
Generally speaking.
Yes. It depends on the situation too. You know, is the patient, did they come from the prison and they're just trying to escape from the emergency room, so they take you and, you know, knock you out of the way? Or is the patient just confused and hits you? You know, you've always got to be ready to get hit or kicked by a confused patient. Always. Yes, and you always claim fear for your life and don't give any information until you talk to your lawyer. I've got my concealed carry license. I know that. You've been hit, kicked, and bit, and not much you can do about it. Yep. You've just got to stay out arm's length at least away from them to prevent that. But sometimes you don't see it coming.
So, Barb, I want to write about healthcare scarcity in rural areas and how that affects the availability of healthcare resources to the patients that are in remote areas, and some of the ways that we can, you know, mitigate that, like using telemedicine and things like that.
Okay. So what would be a question there? How could you form that into a question? And anybody can pipe up here.
That looked like a straight up presidential speech. The flag was behind him. There was some serious crap going on.
That's funny. So I will say, like, so how can we mitigate scarcity of specialty healthcare needs to patients for things like cardiovascular problems, patients with like neurologic problems? and how do we like get them the healthcare they need?
Okay. So you could say something like, you talked about telehealth, telemedicine, telehealth. You could say, how available is that in rural areas? How effective is it? Are people using it? Is there any research out there on something like that? Your topic is very broad, and if you can narrow it down a bit, you'll find more research geared just toward that one topic, and not be in general, if that makes sense.
Yes, it does. I'll narrow it down. I might just, kind of focus a little bit on telemedicine and how that, is, a resource for patients that are in rural areas.
Okay, good. And you can also add, we've got more seniors, more people that are getting into the senior years that have computer, not expertise, I'm not going to say that, but have some computer skills that could use telehealth now. Where a couple years ago, 5-10 years ago, the people that were elderly had no computer literacy at all, hardly. Okay. Hyung says, how about therapeutic hypothermia after cardiac arrest? What's the question there? Nikki, this is recorded.
Who's going to see it but us?
I don't know. It's out there for the public. It's on you. It's going to be on YouTube.
Don't tell me that. I can get way worse.
Okay. Let's help Hyung with hers. Therapeutic hypothermia after cardiac arrest. We already know that that's in use. We already know that there's some evidence that says that is effective. I had a friend here in town that just died a couple weeks ago, a month ago or so. Had a massive cardiac event with hypoxic, I don't know for how long she was hypoxic, but they put her, they cooled her down when they got her to Springfield, and she was like in a coma for about a week. Didn't come out of it. They turned off the machine. But back to Hyung's question. What would be the question there? Because we already know that that's another one of those we already know that's effective.
What are the benefits to using therapeutic hypothermia in cardiac patients versus not?
Okay. So you could look at the long-term outcome. Is there enough research out there to show that has been more effective than those that have not been, that therapy has not been used for?
You can also discuss the risks of it too. Like, do you have a higher chance of dying from that? Or like, what if you just kind of leave them alone?
Okay. Is there an increased risk of stroke due to that? Maybe. Something like that. Does that help, Hyung? I haven't got all the way down to my other messages yet. Again, that's kind of narrowing it down a little bit. And okay, she said she figured out kind of making a comparison or contrast to another therapy. Okay, epidural. We're just going to skip that one, Alyssa. Doll therapy and treatment of dementia. Okay, I haven't heard that one. Samantha, you want to talk about that a little bit?
Well, I've been just seeing some articles out there about, doll therapy with dementia patients. Like Debbie said, I saw her comment. She saw that it helps, I think, in treatment for dementia. It calms them quite a bit, I think.
Okay.
We use it too at work, so it's like just like a comfort for the patient slash resident.
Okay, kind of like animal therapy helps patients with dementia or confused patients or aggressive patients.
Yeah, and our
Yeah.
yeah, and our ADON's been bringing in her dog, and she visits everybody kind of because everybody's restricted to their rooms now.
Uh-huh.
So
Mm.
yeah, anything that makes them feel, at ease or some relief from agitation, I guess.
So they have to stay in their rooms the whole time? They can't go to the dining room or anything?
Not anymore, no.
Mm.
That happened Saturday.
That
It
would
was crazy.
be awful.
Yeah, it's been very difficult for everybody as of late.
Yeah. Okay. Helps with agitation. Making bedpans less confusing? You mean which way you put them on or what?
I feel like I know how to use a bedpan, but every time I touch it, it's like, okay, which way does it go?
You have to mark them or something. Sex dolls for pedophiles to prevent them from enacting their urges on actual children. That's interesting. See, I'm learning things from you guys.
So that one you talked on, but not the butthole hair.
Yeah, I'm not going there. I'm not acknowledging all that. I can't do that. Sherry said her topic is going to be on relationship between cancer-related fatigue and depression. Okay. What kind of therapies or interventions do they have out there right now to prevent depression and fatigue in cancer patients? Does anybody know? There's a question. I don't know that you could compare and contrast that, but
I know a lot of people now with depression and even cancer patients because they can't really get out. Light therapy is a big thing nowadays.
Yep. Yep. You've heard of seasonal depression. I think there's another name for it, but happens like during the winter when everybody's homebound and it's dark and can't get outside and do anything. Seasonal type depression. Okay. Okay. Light therapy versus medical therapy. There's a lot out there too that you could look at with homeopathic medications or treatments versus antidepressants, maybe. Seasonal affective disorder. Thank you, Gage. I know it had seasonal in it. Your mom's on chemo. That'd be a good research topic there. Help you and others understand.
I think a good research topic that I might want to write about is, homeopathic remedies in treating flu. And I might tie in COVID-19 in there, and like, so for instance, garlic, how that can be used as an antiviral remedy for someone that has a flu.
Okay. So maybe the effects of garlic versus giving a patient Tamiflu.
Yeah, exactly.
Or does Tamiflu, does it really work? Or is it just another one of those expensive drugs they've thrown out there on the market, and you're going to get better anyway if you have a virus?
Right.
The flu
It's
virus.
more, it's more like
Influenza.
the Tamiflu is treating the symptoms, while the garlic, the homeopathic remedies are boosting your immune system to prevent you from having the infection in the first place. So I just compare and contrast both of those.
Okay, that's something good. Somebody mentioned marijuana. Of course, as Nikki mentioned it. Just kidding. But really, the marijuana laws have lightened up in states. Still, it's a federal crime, but states have legalized it. We've known for a while that it helps cancer patients. It helps patients with chronic pain. Is it addicting? Is it not addicting? Is it better than opioids for pain? Things like that. Okay, Plaquenil and decreasing effects of COVID. Okay. Aluminum and association with dementia. Okay.
Going back to the flu thing with the Tamiflu and like the other remedies, there was also that mother that recently let her kid die because she was trying to use like essential oils and stuff from like a Facebook group. So I think that's like something really good to write about too.
Mm-hmm.
Yeah, I think so.
That's another thing. Do essential oils work? I don't know. Maybe to an extent on certain things, but is there any real scientific research to back it up? I mean, valid and reliable
I
scientific.
feel like they might work, but I don't really want to rub like, lavender on my kid with cancer. So.
Mm-hmm.
I think I remember reading tea tree oil is a bactericidal or bacterial static, but that's probably because it's an oil, and oils don't really grow bacteria because there's no food for them.
Mm-hmm. Okay, what about naloxone? I can't say that word. Naloxone. What about giving that to patients that have opioid addiction and overdose, and the family using it to prevent overdose or treat overdose, and they do it again and they do it again? Is that a cure? Is that helpful? Since we've went to that, stocking it in ambulances and people's homes, and I don't know. Yeah. What's it do to somebody who isn't suffering from an overdose? Yeah. Should there be a limit? Okay, O2 therapy isn't a cure, but we still give it. It prolongs the disease. Right. O2 is a treatment, right? Okay, Christine says it enables them and makes it to where they can do drugs.
What about the debate about whether drug addiction is a disease as opposed to a choice?
Okay. Why do some people become drug addicted and others don't? Why do some people become alcoholics and others don't? Is it hereditary? Is it running the family as far as they're exposed to it at a young age? Same thing with abuse. And why do people become abusers? Needle exchange programs. Is that a good idea? Okay, it can start as a choice and become a disease or a addiction. Yep, that's true. Especially some of the harder drugs that we're seeing coming out now, like the laced fentanyl. You know, back when I was a kid, smoking weed was a big deal. They had what they called white crosses that you could go to the doctor's office and get. Had friends go get those. They were just uppers, is all they were. Kept you awake. But there's so much more out there, seems like nowadays, than there was when I was a kid. That's dangerous stuff. I'm sure it was there before, but it wasn't as widespread, maybe. Weed for cancer treatment. Okay. I was watching TV last night, trying to watch TV last night, and Sandy and I kept talking, like I said, till after 11 o'clock on stuff, but I record this silly show called Naked and Afraid. Does anybody watch that? Yeah, some of you do. What
No.
I what I find interesting about it, like last night I was watching one that I had taped, and this woman was out in the jungle by herself, and she was getting mosquito bit, and she was very into, I guess, you know, traditional medicines that you could get from trees and leaves and flowers and all this stuff, and stuff you could eat that you wouldn't even think you would eat. But she went to this certain tree and just shaved off some of the bark on it and rubbed it all over her, and that was the insect repellent. I'm learning all kinds of things on here because I always wonder, when you go to these remote places, how did these people like the Mayans, how did they live in a mosquito infested area without getting bit all over? You know, weird stuff like that. So where did our medicines come from, is I guess where I'm coming from on that. Indians used to smoke pot probably, or coke, or whatever they smoked in their peace pipes. You know, they had a lot of traditional medications, that non-traditional medicines that worked. You know, this gal on the show last night, she got a cold and she got very congested, and she did the same thing. She went to a different tree, scraped off some of the stuff off the tree, and put it in a pot to boil, and then the fumes, she inhaled that. She was all better the next day. It's just strange, you know. To me, it's interesting, the things that they come up with to live. Yeah, Alyssa, that your mom proposed the use of weed might have helped some. I don't know. Okay, weed helps a lot of people. The THC wax to chill him out before enduring California traffic. Okay. And peyote, yeah. Indians. Garlic is the best for mosquitoes. It's the best for keeping. That's an idea, you guys. If your husband's bothering you, eat garlic. Run him right out of the room. Marijuana for seizures, yes. Especially childhood
For a minute,
seizures.
I thought you were going to say that's a good idea for your husband, smoke weed.
Oh, well, that might mellow him out, and the garlic would help him go away from you.
Not for him,
Parkinson's, yes. Strain for seizures. Oh, yeah. Yep. Bee venom for rheumatoid arthritis. Bee venom for pain, too, I think. I read somewhere. You drink margaritas to prevent mosquito bites. What does margaritas have in it that has to do with mosquito bites? That's interesting. The tequila keeps them away? The citrus, yeah, probably. Because that's kind of what them, what do you call them? Things that you can buy at the store and you light them and it's supposed to get rid of the mosquitoes, the torches. Citronella, yeah. Yeah. Okay, snake venoms. That always amazed me. Who would think to go capture a snake and get its venom and test it on certain, you know, diseases or conditions? Or who thinks of that kind of stuff? You know, scientists? I don't know, doctors? Botox? Yep. Okay, who else needs help with their ideas? Have we come up with some ideas? Do you need help narrowing down your topic?
Writing on suicide prevention for inpatients.
Suicide prevention for what?
For inpatients.
Inpatients?
Yeah, so those who are currently in the hospital, like what measures we take to prevent that, both on like a physical aspect and also pretty much like a de-escalation.
Okay. How could you narrow that down? Or what's the question about that?
I would think like what's most effective technique, and then also because I personally I haven't really heard anything about like if you're talking to somebody who is like attempting suicide, or is at least pretty close to, like what is kind of like best practice on how to treat that person, what is the therapeutic thing to say. So maybe even just like the education of nurses on the topic.
Okay. Can somebody else help with that? Maybe what would be the signs that a patient was thinking about it? Or how would you know before they did it? There's a lot of research out there on that. Or
We can't hear Gage very well. Can you repeat his question?
yeah, he's talking about suicide patients, inpatients that attempt suicide. You know, what are the interventions to prevent that? What would be a question on that?
Emil Durkheim wrote his basically magnum opus on suicide, and he said the one aligning factor between all cultures of people who committed suicide was that they felt distant from their community. So I guess finding a way to incorporate them back into the community and making them feel useful.
Okay. Most of them think my life's not worth it. Nobody's going to care anyway. I'm just going to kill myself.
Maybe group therapy when they're in the hospital.
Okay.
Sign them up for classes, exercise classes, any classes that are given in the hospital to get them involved and give them a sense of community.
Okay.
So I think, just talking about impact of some medications, and how that can lead to, the increase of someone having suicidal ideation.
Okay. Even some of the medications that you can prescribe a patient, you've seen where you don't give it to them if they have suicidal ideations, or if they stop that medication abruptly, it can cause suicidal ideations. Like, let me think of one. What's the drug to help you stop smoking? You guys know that one?
Chantix.
Yep. Have you seen
Wellbutrin.
those ads? Don't stop taking it abruptly, or don't take it. It may cause, of course, like on the TV, they say it can cause everything from a hernia to a nosebleed, one end to the other.
They stop their antidepressants abruptly.
Yep. So maybe, what are some interventions that can be done on admission? What are some screening interventions that are done in other places that have low suicide rates as inpatients? Gage, maybe something like that you could research. We already know the interventions that you do for inpatient suicidal patients that you know are suicidal. What about those that we're not sure of? Does that help narrow it? We might have lost him. Gage said yes. Okay. All right. Alyssa said, what are some interesting topics you would like us to write about? I don't know. We've thrown out a lot of topics on the table to give you guys some ideas. Find something of interest that you think that you can ask a question. Why do we do it this way? Or why is this better? Elaine, okay. Okay, Elaine, I'll answer your question privately, okay? Donna, what about THC used for anxiety and PTSD patients? Okay, Donna, compared to maybe antidepressants, do they have a better outcome? Yeah, something like that. Oh boy. Now, I seen how this conversation can go downhill really quick, so let's watch that. Now this is fun. Who's Molly? What other topics are you guys thinking about that you need help with? If you pick something general, try to narrow it down. I hadn't really thought about the nursing home patients being made to stay in their rooms. That makes me really sad. Social determinants of health in nursing education and nursing practice. Yeah, I'd heard about the nursing homes being closed to visitors, and people that non-essential personnel, but hadn't really thought about the other. If you guys live in those areas, something you could do maybe would be cards to the residents. That would be nice. That would be pretty cool if you could send cards to the nursing homes and just tell them, you know, pass them out to the patients. Send a little bundle with a little, you know, note on each one. We're thinking of you or something like that. Pictures, yeah, that'd be good. Okay, anybody else need help with their topic?
Like the kids home to make a bunch of cards for the residents, could that count as community service?
Yes.
Okay.
I think that would be wonderful. I think that would be wonderful. Get your kids involved.
Oh, so the kids can make the cards?
You can help
and
them.
that counts as our community?
You can help them and deliver them, yeah.
Sweet, I like to color, that's fine.
Or coloring pages, Easter cards, Benita said. The question was if your family, kids, you, whoever, friends, family, got together, did some cards for the nursing home residents, and you took them over to the nursing home, I think that would be wonderful community service.
Hey Barb, if we turned in our community service
Barb,
class, do you want us to submit it again, or can you see it from the last class?
I can see it from the last class, and that reminds me, I just put up a drop box for it earlier today. I think it's in week 1 or in general. It's up near the top, under the right under the community service form. Okay. Anything else? You guys got any other ideas for community service that might help with this, something like this that applies to the COVID scare going on?
Donate your extra toilet paper to those in need.
Okay. Only problem be how would you find out who's in need, you know? I thought about that too.
I got Nikki. Does that count?
Yeah, you covered Nikki. You're good. And pray for moms at home with kids. Yes, because it's a transition to have your children at home while you're trying to work or go to school. I know. I've been there.
I'm not made to homeschool my children.
I didn't go that far with them, but I know how it is to have young.
Yeah, I'm going crazy.
Give them something to do.
We're having a blast. My
Make
kids
cards
love
for
it.
the
They
home,
don't
or not
feel-
homeless, the brain dumping. You know what I mean?
Yeah, make cards. You guys could even make some posters or take some pictures and make a little picture book for them. You know, take some, I don't know what you take pictures of, but if you have some on your camera like I do of flowers and trees and animals and things like that, you know, people with dementia might like seeing stuff like that. I don't know. Even people without dementia. What about, yeah, what about homeless too? You got any homeless in your area?
I was just thinking about that, like donating or things like that to homeless shelters and just getting the receipt. I guess that might be community service.
Maybe. That wouldn't take a lot of effort to cover 2 hours of community service, I don't think, unless you had a lot of stuff. I don't know. What else could they do? You know, what else could they do in their rooms? You might donate some puzzles or some magazines or something to the nursing home. That would be good for them to look at. Care packages with the little toiletries in it. You know, the little travel size toiletry stuff. I bet all that's on sale right now. Yeah, had a visitor visit through the window last week. Yeah. Okay. If you guys don't have anything else, need any help with ideas or something, I guess we'll close down. Keep the ideas coming among each other. If you guys got a Facebook page or something, you know, that you've got going, think of some other ideas maybe for these people that are shut in the nursing home. I think that would be a very good cause to get involved in. Anything else, you guys? And Elaine, I'll get with you in a little bit. I'll think about your idea and give you a email, okay? Or you can email me and give me a little more information on what you got. We'll talk about it. Okay. You guys stay safe, stay warm, stay in, stay out of trouble. Yep, I think this class is fun. It generates some thinking, some ideas. You guys have a good weekend. If you need anything, let me know, okay? I'll try to get this recording posted to YouTube and get that to working. It's a challenge for me. Good night. Oh, there we are. Bye. Where did my screen go?